The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome to Health Matters. I'm your host, Dr. Lana Marconi. On today's show, we're going to celebrate World Pride 2014. Kindly welcome my guest. She is a co-chair for World Pride as well as an assistant professor at Factor in Wintosh Faculty of Social Work at University of Toronto, Dr. Shelley Craig. Welcome, Dr. Shelley Craig.
Thank you, Lana.
Thanks for being here. World Pride, it's exciting. Tell us about it. What's happening? What should we expect to see at World Pride?
It's very exciting. So I'm really excited to be here. Toronto is the most proud city. World Pride, this is the first time we've had World Pride in Toronto. In North America. Wow. Toronto won the bid about 4 years ago to host it. We are anticipating, we have over 150 affiliate events. It'll be very exciting. We have over 10 free outdoor stages, which are hosting about 300 different artists, which are amazing. We have Deborah Cox, we have opening ceremonies with Deborah Cox and Steve Grand and Melissa Etheridge, who are amazing. And we also will have, throughout the course of the week, I would say just an amazing group of events. So we have a human rights conference that's co-hosted by the University of Toronto, which is amazing, and the wonderful folks at Sexual Diversity Studies. And we are really looking at 150 affiliate events. We have partnerships with TIFF, certainly, with OCAD University, with Gardner Museum, with the ROM, for example, and a number of other different partnerships.
It's a huge event. I mean, the expected attendance is supposed to be over 1.2 million people coming for this event. National Post in 2012 said that 5% of Canadians identify as gay, lesbian, transgender, or bisexual. 5% of the population, 35 million people in Canada. That's like 1,750,000 people. So people know people who are of that community these days, right?
Exactly.
Yeah.
Yeah, and we are, particularly for World Pride, we typically average between 1 and 1.5 million for our Pride every year. So for World Pride, we're looking at potentially over 2, maybe 3 million people.
And it's not just a party. Like, you guys have Family Fun Zone.
We do.
What is that?
We do. Family Fun Zone is amazing. There's sort of an association with kind of the idea of family pride. So folks bring their children, and there's a whole space for gay families and a whole lot of amazing programming for families with children, and there's all kinds of events there.
So what type of floats should we expect to see this year? And the floats get judged, right? And people win prizes for choreography and the best representation of human rights, from what I understand.
Absolutely. So we're anticipating biggest, I don't want to give everything away, but there might be some electricity involved. Electricity, a lot of feathers, more feathers, I think, than we see usually, a lot of glitter. I would say clothes on. For the most part, we will see, certainly what happens, but, and we're anticipating, we've added length to the parade, so we have 3 parades. We have a Trans Pride Parade, which is on the 27th.
What is that? What is the Trans Pride?
Trans Pride is, and we also have Dyke March, and then we have sort of the larger parade that most folks think about with a lot of the floats. And so the Trans March really is a group of folks. We have a whole wonderful Trans Pride team, and what they do is they really organize folks that are supportive or involved in the trans community, and they sort of have a pride really just celebrating trans individuals and folks that have had really sometimes a hard time, and really we need to celebrate some of the folks that have had issues with gender identity and transitioning. So it's a really important pride.
Okay, this is something I pulled up. Themes of Pride. 2001, the theme was Love is in the Air. 2002, the theme was Uncensored. 2003, the theme was Diverse, Defiant, and Divine. Nice. 2004, the theme was Bursting with Fruit Flavors.
That's amazing.
I mean, I love it, but who comes up with these names? What is the theme this year?
That's great. I kind of wish it was bursting with fruit flavors. No, but because it's World Pride and our theme is Rise Up. So we're really highlighting human rights. We have the Human Rights Conference. We have most of our former international grand marshals that are coming back who are going to lead the parade. We have a number of folks from within the context of the Human Rights Conference and then within the context of the larger event that are coming from countries such as, you've probably read in the news, heard in the news about Uganda. We've had a hard time getting visas for some of our Ugandan GLBT leaders, as well as from Russia and from a number of other countries that really experience harassment and discrimination based on their sexual orientation or gender identity. So Rise Up kind of goes with that theme, right? Because it's really thinking about pride, sort of to get to your earlier point. Pride is really a celebration of culture, which is really important, right? And we think of that, you know, as critical, but it's really, and one of the things that we might not always think about in Canada, because there's a lot of work to be done, but we're very fortunate to have quite a few policies and laws passed to protect queer folks. So, but it's also really about human rights, because in many countries, including some of the countries that I mentioned, and Russia has been in the news, we certainly know that just the act of getting together and trying to organize a parade is something that can get you thrown in jail and is really in many cases a violation of the law. So gathering together and celebrating that. So I think it's really a human, I think all Pride events are really human rights events.
So
and we
Rise
have to
Up,
remember.
Melissa Etheridge's opening, she wrote the song Uprising of Love. A lot of those proceeds, if not all of them, go to the Russian Freedom Foundation.
Exactly.
Right? What happened with the Olympics there. So the president there, Vladimir, he equates homosexuals as with pedophiles, and you know, he says we need to cleanse Russia of homosexuality in order to increase our birth rate. You know, what do you think about that, Dr. Shelley?
Well, what that illustrates is that there's so much more work to be done, and we need to really use the privilege that we have living in Canada, I think, to do work to help support our colleagues and our brothers and our sisters and our friends in other countries, because there's always the homophobic and heterosexist attitudes that are enshrined in a lot of policies and laws, which Vlad happens to espouse. There's variations of the same theme, right? But it tends to be sort of the same homophobic theme. So what's unfortunate is he is an individual that has a significant amount of power, and he is enacting that and really creating havoc.
What was really cool is AT&T was one of the first corporations that stood up against it. Shelley, hold that thought. We'll be right back. More Dr. Shelley Craig and World Pride 2014 on Health Matters. World Pride takes place Friday, June 20th to 29th. Toronto will open its doors to people from all corners of the globe for this 10-day international celebration. For more information, visit www.worldpridetoronto.com. Welcome back to Health Matters. We're talking about World Pride 2014. I'm joined by guest Dr. Shelley Craig. She's a co-chair for World Pride. Shelley, okay,
thank you.
How can people volunteer if they want to at World Pride this year?
Well, we still need volunteers.
Okay.
So please sign up, www.makepridehappen.com, and you can help out. It's an amazing time. You get to meet a lot of friends, potential friends, also potential enemies. But I think we really need volunteers, and I would strongly suggest going to that website and going through the process to join. It's very easy, and I guarantee you will have a great time.
Sure, and this is by volunteering. It's a skill that they can actually put on their resume, I'm sure, right?
It is. It is. Yeah.
Right. And so what's your involvement in World Pride? What do you do? You're the co-chair. What does the co-chair do?
What does the co-chair do? So the board is also volunteers. I just want to make that clear.
So you don't get paid for
Exactly. We don't get paid. We do sometimes get food.
Okay.
So
Oh,
like
good.
usually Mexican food, which is amazing.
They feed you.
But exactly. So we're happy about that. So so as co-chair, so I've been on the board for a couple of years. I was on a Pride board many years ago. And Pride Toronto has a 12-person board. And so it's a really great, energetic, enthusiastic, is that a nice reframe? No, they're wonderful. Group of folks that has a great deal of either community activist experience or corporate experience or work in the nonprofit sector. So as co-chair, we tend to try to build a healthy and strong board and sort of support the work of the volunteers and the staff within the context of the organization. So a board's role tends to be setting policy. It's not very sexy, right? But also in many ways we tend to have sort of fiduciary oversight, so making sure that the fundraising is going according to plan and that we have oversight of kind of where the money's going, that it's directed to the right causes.
Yeah. So does a person need to be gay or lesbian to be a volunteer, to be on the board? Can a straight person say, hey, I want to volunteer? You're looking for anybody.
We will take, yes.
Because you're all about love.
We are
and
all
embracing
about
everybody.
love. We are all about, I think, celebration.
Yeah.
We are all about allies and support. I think sort of the movement that Pride is part of this larger human rights movement, needs everyone.
Sure.
We need everyone. We're all in this together, in all honesty. So in many cases, allies have family or friends that might identify as queer, certainly. But everyone is needed and everyone is welcomed within the entire organization of Pride. I think it's really important that we're inclusive.
This is really interesting, 2014, because Canada has evolved. It really has evolved. At one time, homosexuality was a criminal offense.
Yes.
And it was also a mental disorder.
Yes.
Right?
Yeah.
So maybe talk a little bit about how maybe Toronto has evolved first and then Canada, like in terms of marriage licenses, like back in 2003, and then federally 2005.
Exactly. And marriage is an important part, I think, of the overall movement, and we see even with our neighbors to the south what a difference that has made in sort of legitimizing relationships, certainly. And in Toronto, I know the first Pride Parade was in 1980, depends on official, 1980 or 1981. It depends on what timeline you're looking at. Before that, in the early 70s, there were a number of different sort of parades and events, but it was really formalized, I would say, in 81. And that was also the year of the bathhouse raids, which was really a big human rights issue. So really talking about those two things happening in tandem, I think is really interesting. We also have a number of issues that sort of happened in 1969. We have Stonewall in the U.S., which we really talk about as sort of the official beginning of what we used to call the gay liberation movement. That was also the same year that homosexuality was decriminalized here in Canada, which is really interesting. So it shows how progressive Canada really is. Canada is really considered a human rights leader in this area. Again, although we have much more work to do, I think that's critically important.
Yeah, I mean, the whole definition of marriage has changed from the traditional definition of marriage based on the British common law was the lawful union of one man and one woman to the exclusion of all others, right? And then after the case of Halper versus Canada back in 2003, the Ontario court ruled that the voluntary union for life of two persons to the exclusion of all others. And that really sparked the flame for other people of other countries really to come to Canada to get married, such as what happened with Edith Windsor, right? And that whole story with DOMA. Maybe do you want to talk a little bit about that?
Well, Edith Windsor is one of our special guests.
Oh, nice.
Yes, so
Very
she's
nice.
coming for World Pride. She will be honored with a World Pride Award, which we're very excited about, at the World Pride Gala, which will be the 25th. Katie Lang is our headliner for that. So she really, even though her partner Thea had actually passed, Edith Windsor was really the case that overturned DOMA. She really pushed for recognition of her, for her relationship as a marriage, and she's really the pioneer that really pushed, along with a lot of other advocates.
So for folks at home, DOMA is the Defense Against Marriage Act that was signed in 1996 by President Bill Clinton at the time, and it prevented same-sex couples from getting married at the federal law, even though states you could get married, such as in California. Now that DOMA well, it's Section 3 of DOMA that has been abolished. So you can get married now federally in the United States, but each state doesn't have to recognize that. However, there are tax benefits to that. You can, visit your spouse in the hospital. Like, it opens up a whole new world for people who were in that category, right? Like Edith Windsor, and they hid for a long time because they were, as a couple in the 60s, right, during a time when homosexuality was condemned, and they had to hide much of their relationship, which was really sad. So it's great today how things have just evolved to such a nice level.
Right, and it's really, and the evolution is really because of the amazing work of the people on the ground that are fighting literally these battles every single day, right? When they're even coming out to their friends and family, they're working on passing policies at their place of employment many times, at their schools. So it's really, the evolution is wonderful, but the evolution is really related to all the hard work that the folks that have come before us have really put in.
Yeah, she says, because I was watching Time interview on her, and she says, the truth is that if you really care about the quality of somebody else's life as much as you care about the quality of your own, you have it made. And really that's what it's about, I think, is coming from that place of heart-centeredness and compassion when you're treating other people. Right? I think they got it right.
I think so.
Yeah.
I think so. Yeah. And really using empathy, putting yourself in another person's shoes, even if that hasn't been your experience. So we see that with a lot of the allies that volunteer with Pride Toronto.
Yeah, in Oprah magazine, Susie Orman's really they about it.
She is. She is.
Because her and her partner got married in Africa.
They did.
And she coming back, they could sign on customs that they're now a family.
Yes.
We'll be back more with Dr. Shelley Craig and World Pride on Health Matters. Come on back. Toronto will be the first World Pride celebration ever held in North America and the fourth festival in the world. World Pride brings people together from around the world to honor and celebrate LGBT communities everywhere. Welcome back to Health Matters. We're celebrating World Pride 2014. I'm joined by guest Dr. Shelley Craig from the University of Toronto. All right, Dr. Shelley.
Thank you.
What is your personal journey in the gay and lesbian community?
This is a great story because I think it's where your volunteer work and your actual employment, social work, all sort of fit together. So I came out as a lesbian, I would say, it's hard to remember that long ago, maybe when I was 18 or 19.
Okay.
And since that time, I worked in social work, and I ran a number for about 15 years. I started and ran organizations specifically for queer youth. Okay. So we know that queer youth have a number of health disparities, for example, high rates of suicide, high rates of depression and anxiety, a lot of self-harm that happens. And throughout the course of that work, though, I really began to understand some of the different resiliencies and the abilities to bounce back from all of these really terrible things that were happening to these young people. They were kicked out of their houses in many cases. I was carrying them sometimes
because of their sexuality?
Because of their sexuality or their gender identity. Many of the young people I worked with, their parents said, if you're gay, then you don't have a home anymore and you don't have a family.
Wow.
And so that is really, obviously that's devastating. And so this has really sort of been the evolution, I would say, of my life's work. And within the context of figuring out how to create programs to decrease these risks, I really became acutely aware of how resilient these young people are. So despite all of these things that happen to them, they still, most queer youth end up growing up very healthy and happy, and have relationships if that's what they so choose. And so I'm trying to understand in my research some of the processes that contribute to that. And what I know is a sense of community, so decreasing that sense of isolation or feeling like you're the only one is really something that is important.
Is that how you felt when you came out?
I didn't, because I had relatives, including my sister, who also came out around the same time.
So you had a support system.
I had. So I had, just my sister. I had one support system.
But still, that's something.
That's
right?
helpful.
A lot of people don't have anything.
Exactly.
Now, do you think, Lady Gaga sings, "You were born this way. God makes no mistakes." do you think being gay is a choice, or do you think it's genetic?
Well, most of the research really points to genetic. But regardless, I would say it really shouldn't matter, right? The choice in many cases is really being honest and telling folks who you are.
Sure.
But many people can't, for safety reasons, go through that. What I found within my work with queer youth for many years, and one of the reasons that I decided to get involved in Pride, particularly here, is that idea of coming to a Pride festival, wherever it was that I was working with them, sometimes it was around Toronto and many times it was in the US, coming to a Pride festival was in many ways sort of the culmination of their integration of their identity. Seeing yourself represented when you have felt isolated for so many years really was part, honestly, of, in many cases, their case plan. Figuring out how to get them to Pride, that was something that they wanted to do, and it really shifted something in terms of a young person's development.
And is this a population that you're still working with today?
Yes.
Okay, because you have a lot of research, and I've read a lot of your research papers, and I think you're brilliant, the research that you do, and you know, God bless you for the work that you do, really. One of your papers is called You Can Form a Part of Yourself Online, and it's in the Journal of Gay and Lesbian Mental Health. And it talks about the digital age coming out on the internet. So maybe speak a bit more to that.
Sure. We did quite a bit of research actually in Toronto with young people, and what we found is that back in the day, right, young people used to seek out services because we didn't really have online. They used to seek out services and community just in person. And what we're finding is they are in many ways practicing coming out online because it's one of those things that you're afraid that you will be rejected. In many cases, young people still are. So they're creating their identities and practicing coming out online. And in many cases, that translates to a better experience coming out in person, including to their friends and sometimes to their family. So it was really interesting. They were able to learn from one another. It was become sort of a peer support group where young people online are asking each other questions about, you know, where to find resources or sexual orientation. It's very fascinating. So in this resiliency model that I'm, you know, kind of obsessed with, in many cases, they're really helping each other out. So how can we support young people that are really building their own networks?
Is there a distinction between the types of messages sent by traditional media versus the type of messages sent online?
Absolutely. And so the difference we found with traditional media is it's almost it's consumption. So a young person, any person really, doesn't have the ability to talk back to the images that they see. So the queer narrative, the queer youth narrative, is usually suicidal, or maybe the gay best friend who has to be, you know, very fashion forward, possibly a hairdresser, right? Those kind of things. So it's a very limited scope, and it tends to be not a diverse group that's represented. Within the context of online, young people are able to consume these messages, but they're also able to re-author them. So in some cases, they will have seen something that sort of went down on a TV show, go online and blog about it or talk about it or make comments, and that really increases their self-esteem, right, and their coping skills, because they're able to kind of fight back against these messages that might be marginalizing. So it's really production. They're able to produce.
They're participating.
Exactly.
Is there a difference between private and public identity?
I think there are. It really depends often on the young person. And so one of the things that I think that social workers can do, or other practitioners, including parents, is really work with young people to not necessarily just limit their use of online technologies, but how can they, in a harm reduction approach, think about what it is that they're posting and who it is that they're potentially interacting with, right? And so maybe making the distinction between private and public for the young person and helping them determine what that should look like.
In your other research article, Strengths First, you focus on what their strengths are.
Right.
It's
really the focus of my research, and this is a case management model that really starts at the strengths instead of what's wrong. And if you increase the strengths in many cases, you automatically decrease some of the risk factors, at least on the individual level.
And that builds their self-esteem. Dr. Shelley Craig, thank you very much for joining us today. Come back anytime. Folks at home, get out there and join World Pride Toronto this year. And as a final note, I'll leave you with a quote by Lady Gaga. She says, "Rejoice and love yourself today. Have a wonderful evening."